Daniels, and
I'm Jenny's husband, Dr. Robert Daniels.
yes, today we're going to talk about how we can keep our breath fresh.
That's right. And I'm a periodontist. I've spent my working life keeping people's mouths healthy by treating their gums and doing surgery. But I've always wanted to talk about preventing halitosis or bad breath.
Yes, because obviously we talk a lot about bad breath because wherever we go, there's really bad breath. Joking about it, but it's not really a joke because it's a serious problem.
Yeah, and the thing about it is it's so easy to prevent halitosis and bad breath. And it's so nice to have fresh breath when you're at work or with your partner or out with friends. So let us show you how to keep your breath fresh. It's not overly expensive, it's not overly time consuming, and there's no reason not to.
It's here that, when we are in the gathering or we are in the office, one room, or in the elevator, and then if there's a breath really that is too strong, I swear you will not try to breathe.
Yeah, or cure. And so I just want to tell you some preparatory things. You have your own oral hygiene regimen that you do every day, and that's what we're going to talk about mostly. But one of the things that you would want to do before you take on a new hygiene regimen, or just with the one you're using, is some people, not all people, but some people develop calculus on their teeth. It's a hard, one of the things that you should do is go to the dentist, get your free exam usually, and then get a cleaning annually. And of course, you may have other dental work to do, and maybe the hygienist or the dentist is going to try to talk you into getting dental work, which again, a good thing if you can afford it, and if you're not a dental phobic. But the one thing you definitely want to do is get your annual cleaning or twice a year cleaning, because that calculus you can't clean with floss or with a toothbrush. So that's something that you have to get done at the dentist.
Yeah, wait.
And so, yeah, lots of people are in that situation, but we're not talking about that right now. Basically, we want to give you a simple way of keeping your breath fresh.
We need to talk about it because there are so many people really that don't take good care of their mouth. It's like the person near to you. It's some kind that you are afraid to tell them that they are bad breath because you don't want to offend them. But sometimes there's really one of the.
Well, it is true. I mean, you're gonna bump into bosses and fellow students and fellow workers and even people in your family that have chronic bad breath. We call it halitosis as dentists. And so let me get back to a little preparation and a little bit of knowledge base about keeping fresh breath. And so, again, you probably are going to have to go to the dentist every 6 months or annually to have them clean the calculus off of your teeth, something you can't do with a toothbrush or floss. And some people don't form calculus. So you may be one of those, and that's great if you are. But if the dentist or the hygienist, tries to get you to do your other dental work and you can't afford it, or you're a dental phobic, just tell them that, you're a dental phobic or you can't afford it right now, and that you just want to make sure that you have good oral hygiene and prevent further decay by coming in for your annual cleaning or biannual cleaning, and tell them when you can afford it or when you get over your fear, you'll definitely have your dental work done. But I know some people are afraid to go to the dentist because even to get a cleaning, because they're afraid that the dentist or the hygienist will give them a hard sale pitch, and but just put them off if that's the case.
So how about the people that it cannot even afford to go to the dentist?
If you can't afford it, then just listen to this lecture and do the best you can with your oral hygiene regimen at home.
Especially the parents, to their children.
Yeah, so even if you are unable to go to the dentist, this will help you to keep your breath fresh and also to prevent further damage to your dentition. So the other thing I wanted to talk about is the places that cause bad breath or halitosis in your mouth. So everybody knows that their teeth, around their teeth and their tongue are places where bacteria can form and cause bad breath, especially between your teeth, because the bacteria that cause bad breath are usually what we call anaerobes or facultative anaerobes. It just means that those bacteria can survive in an environment without oxygen. So they're tucked down in the space right at your gum line around your tooth, and that's called the sulcus gland. Even in small quantities, they can cause bad breath. And so you really want to do and learn how to do a good job of flossing and then brushing your tongue. And that takes some practice. So the other place is your sinus, and your sinus communicates with your oral cavity, and so your sinus is lined by mucosa, and if you have like chronic allergies.
Oh, that's me.
Yeah, and it was me at one time too. If you have chronic allergies, what happens is your mucus or your mucosa is inflamed, and an inflamed mucosa is a very good place for bacteria to grow and fungus. So the other thing besides your oral cavity is your sinus, and we have some very, very good tools, simple tools, inexpensive tools to clean your sinus. The Taoist monks would wake up every morning, and one of the first things they would do would be to rinse their sinus. So anyway, let's get right to how to clean your...
No. This is I just share this story because I hear somebody says that when you brush your teeth before you sleep, obviously your mouth is clean, and then when you wake up in the morning, even you have bad breath, he said that your mouth is still clean. Is that true?
Not exactly. No, anytime you have bad breath, it's because of bacteria, either in your sinus or around your teeth or in on your tongue. And I would say around your teeth and in your sinus actually are more prominent because that's where anaerobes can survive more readily. So anyway.
And then, this is nasty. I know this is nasty, but when I start using it for the first time, about the rinsing,
the sinus rinse, yeah.
The sinus rinse, it's really nasty. It's like as big as this one, but longer than this one, come out from my nose.
Yeah.
So it's really nasty, but it's really true. And then, did I have bad breath before?
That was one of my favorite movies, Alien, and I think that she had a little baby alien out there. But anyway.
No, I have bad breath before.
Yes, and my wife did have bad breath, more than she had to, and since she was married to a periodontist, of course, I had.
Because obviously, me, I just learned about floss. I think I'm already 30 years old, so it's like children's hygiene, and I am the good example with that because. I almost lost all my teeth, and now my husband replacing it at very, very expensive.
I know this is a little bit gross, but since my wife already started the gross stories, I'll continue. But if you take the floss out and you smell it, and you can actually tell if you have anaerobic bacteria proximally, and just keep flossing and rinsing until it doesn't smell anymore, and that will take care of that. So you know, it is a skill, and for some people it's irritating. For me, it's not. But
I don't know if they already teach that in the public school there in the Philippines, but
and yeah, and you think about that. If your kids are going to school and they have toothaches and they have bad breath, but again, this is a simple thing, and so first step.
simple thing which is very important.
Yeah, very important. Exactly.
Yeah, very important. Now I realize how important the teeth are.
Yeah. So, and even professional. You know, I have to say that I didn't use a nasal rinse for a long time, and I have a disease called Wagner's, which causes a lot of inflammation of your sinus. And you know, I had real trouble keeping my breath fresh as a dentist. You know, it's something that
It's a work for you.
you know, it's a very important thing for doctors and dentists, and really all professionals
You know,
to have fresh breath. But yeah, so even I did not fully understand how to, you know, keep your breath fresh. So again, I'm going to give you guys the advantage of what I learned, so make it easy for you to have fresh breath.
And this is also very important to the people really work near to the, you know, to the person, because like for example, like really work that near to the person, I swear it's so irritating, and some kind that you will the one who embarrassed for that person.
It's salty, but some people. But okay.
Okay.
No interruptions for a second. Let me get through this. Sorry, dear. So, you know, I recommend using Arm & Hammer toothpaste because
They will pay us.
it has some abrasive effect, but baking soda is not harder than your enamel, so it won't abrade your enamel. But other toothpaste that may have abrasives that are harder than your enamel, just don't use them 2 or 3 times a day, because eventually it'll wear your enamel and maybe your roots.
Oh really? Why is that in the...
Paste toothpaste is the one that looks like white.
Yeah, Colgate, that is Colgate.
Yeah, like Colgate. And like I said, they're very good for cleaning hard to get off plaque, and maybe even clean off some of the calculus, but not all, of course, without a hygienist. So anyway, I'm assuming that everybody knows how to brush their teeth. And if you've done all that, and if you want to invest in something that is really wonderful to use and helps you clean out some of those anaerobic bacteria, you can get something called a water pick and invest. But if you can't invest in this, it doesn't matter. If you do a good job of flossing, brushing, remember to brush your tongue, and you rinse well, you can certainly use mouthwash if you'd like to, you'll be fine. And the thing is you'll get better over time, because as your gums become healthier, they don't harbor as many anaerobic bacteria because they shrink and get tight. And it's not as easy for the anaerobic bacteria to exist in there. So if you keep this regimen up over time, you know, you will have an easier and easier time of keeping your breath fresh and your mouth clean and your oral tissues healthy. So, and then finally, even for people who don't have chronic sinusitis, it is a good thing to rinse your sinuses periodically. It will make your sinuses healthier, and if your sinuses are healthy and not inflamed, you'll feel better. As a matter of fact, if you have an old teapot, a small one, that you don't use for anything else, you can use it as a neti pot. And I really did have actually trouble keeping my breath fresh, even as a dentist, was the irrigation of my sinuses. And in my case, because I had a disease that causes inflammation, I also had to get some other treatment to shrink my sinuses because I have a disease called Wagner's granulomatosis, and that required another kind of treatment. But most people don't have Wagner's, and most people, if they have sinusitis, you know, you might have a steroid spray, you might have antihistamines, but you should also include sinus irrigation. And sometimes, I know my wife and I are very honest with each other. So if I have bad breath, and on occasion I did have some sinusitis from seasonal allergies, and I also had a tooth, oddly enough, that I had fractured and had to come out. But before it came out, it had some exudate, and so that's another thing that can cause bad breath, an infected tooth. So, my wife is very honest with me and says, "Yeah,
Yeah, I am.
did you brush your teeth tonight or something?" But you can't be offended by that when your partner is telling you that. And likewise, she had sinusitis, and she had no idea that she had bad breath. And I told her, and she rinsed her sinus a couple times, and that resolved it. And so, yeah, you can be honest with your partner if nobody else.
No, I really wish that we can really tell somebody if there is somebody that smell like that.
Even if we can't be totally honest at work or in public, we ourselves can have fresh breath. And if you're a professional, if you're a teacher, if you just like being around people, going to happy hour or something, yeah, how wonderful to know that you're inexpensive as $3 or $4 for a neti pot, some floss, and your toothbrush, and you got it whipped. There is one other source of bad breath, and that would be from your gastrointestinal tract. And if that were the case, you would have to have that explode. Bad breath caused by the gastrointestinal tract is cancer. And so, either esophageal cancer or stomach cancer. So that would be the one other source. And if you are doing a great job of cleaning your sinuses and your oral cavity and you still have bad breath, then certainly you should be going to a doctor, an internal medicine doctor or something, and have that checked out.
Okay, now we're going to show you guys how to use the irrigator. Is that an irrigator?
Yes, we can show them how to use a sinus irrigator.
Yeah, right.
Okay, so my wife's going to film me while I go through these tools and techniques for cleaning your teeth and your sinus. So I'm going to start off, some people haven't flossed regularly, and so they don't know the technique. And what I can say about floss is that you want to make sure that you have an adequate length of floss. And so, I take a pretty good length of floss here. And the reason is so that you can wrap the floss several times around your finger. And otherwise it tends to slip off your finger. And then you can see I take a good amount of time in between each teeth. I know some people race through it, and that's not adequate unless you really don't have the time, and you have to do that. But otherwise you want to remember you have two surfaces. You're between two teeth, and you want to clean each tooth. So that's flossing. The second thing.
Wait. Okay.
And I do it either way. Sometimes I floss first, and sometimes I brush first. And it really doesn't matter that much. So next, I want to show you the perio pick. And this is the instrument that rinses between your teeth with a pulse of whatever you have in here, whether it be salt water or plain water. You can just put plain water, actually, or mouth rinse, or a combination of those. And so what I usually do is I actually go and heat up some water in the microwave, and then I put some salt in it and make a salt rinse. I put that in here, and oftentimes I combine that with mouth rinse. But in this particular case, I'm just going to put water in here. And I'm going to put warm water because it actually feels better if it's warm water. It's kind of a comforting feeling. Okay, so I've got the perio pick all ready. and you'll notice I'm keeping my mouth closed and I'm holding it over the sink. You can have some accidents, or not serious accidents, but you can actually turn this on accidentally and spray it around the room.
It's always happened.
You could probably use it for cleaning other things besides your teeth, but yeah, you'll notice I put my lips around it kind of and over the sink. So that's the technique with this. It's very simple to use. And I see my wife has gotten rid of a paper towel, so sorry about that. And the final thing is the sinus irrigator. And like I said, I could use a neti pot, and it looks like a teapot. And if I were using a neti pot, once again, I would fill it up with a saline
Let's show it.
Yeah.
And this one. Actually, you will show that there.
And usually, the neti pot's going to hold something around 30 or 50 milliliters of liquid. So again, you could use cold water. That would be fine. But most people want to warm it up a little bit. And then you open one of these packets. And this contains both salt and baking soda. And you could just use baking soda, or you could use just salt. And to be honest, for me, I can just use salt, and I just put a little bit of salt. As I said, I warm up some water in the microwave, and I put a little bit of salt in it, warm it up, and I put it in this. These are pre-measured packets. I'm going to put this in. There are other solutions for this that you can buy in the store that can contain things in addition to salt or baking soda, but this is certainly fine. And you can see I'm just using the end of my toothbrush to stir it, because you have to get the salt in solution. And then you just put the top on. And the same thing with the irrigator. You kind of want to have it up to your nose when you turn it on and turn it off when you have it away from your nose. But what's going to happen is the solution is going to go up, enter your sinus. It's actually going to cross over to your other sinus and then come out your other nostril or in your oral cavity. And so it's something you kind of have to get used to. As I said, if I had a neti pot, I would turn my head sideways a bit and pour the neti pot in like this, and that takes a little bit of practice too. I'm just going to dry this off a little bit because it's wet. Okay. And it's not uncomfortable. It's for some people it's might, but I've been using this for so long, of course.
Wait. Okay.
And you can do
Wait. What happened here? There.
So you can do that on one side of your sinus, and you can flip it over before it's empty. And then, or you can see it keeps draining out my nose here, but anyway, then you could fill it up again. You could do the other side, especially if you're having some sinusitis because it's allergy season. And I do this, for me, I can do this virtually every day, and my sinuses don't become dry, but some people's they become dry, and they actually could bleed because they essentially dry out. But do it with the frequency that you're comfortable with. And like I said, it's helping your overall health. If you have sinus headaches, if your sinuses are swollen, this is only going to help.
Okay guys, that is for today, and please don't forget to subscribe, like, and please share this video. This is very important for everybody.
Well, I hope we helped you out a little bit with your oral hygiene regimen and with your breath. Thanks for watching.
Bye.
Bye-bye.